The chair now begins the committee on the topic healthcare infrastructure.
We shall begin with the roll call. When your delegation is named, please rise and state whether you are present or present and voting.
Present voting.
Nepal, Italy,
Present voting.
Egypt, United States of America, Saudi Arabia, Germany, Canada.
Now recognizes the delegate of Japan to speak.
Honorable Chair, distinguished delegates, the delegation of Japan is honored to address this assembly on the critical topic of healthcare infrastructure, an issue that holds the power to shape the very future of our global community. As a nation committed to innovation, resilience, and human welfare, Japan recognizes the vital role of healthcare infrastructure that plays in securing the well-being of every citizen. Our country boasts one of the most efficient healthcare systems in the world, combining universal health insurance with cutting-edge medical technology and an emphasis on preventative care. However, we are not without challenges. Japan faces a rapidly aging population requiring us to innovate in elder care, promote telemedicine, and build stronger public-private partnerships. Arigato gozaimasu. Thank you.
Thank you, distinguished delegate of Japan. The chair acknowledges your delegates' detailed insights, particularly Japan's emphasis on aging population preparedness, technological innovations in healthcare, and the importance of international cooperation.
The chair now recognizes the delegate of Denmark to speak.
Honorable Chair, distinguished delegates, the Kingdom of Denmark is honored to contribute to this vital discussion of healthcare infrastructure. Denmark firmly believes that accessible, equitable, resilience are the healthcare system of foundation of healthy and just society. As a country with a universal publicly funded healthcare system, thank you.
Thank you, distinguished delegate of the People's Republic of Denmark. The floor is now open to the next speaker.
The chair now recognizes the delegate of South Korea to speak.
Honorable Chair and esteemed delegates, the delegate of Republic of Korea is honored to address this committee on a vital subject of healthcare infrastructure, a pillar of national resilience and global well-being. South Korea's healthcare system is globally recognized for its efficiency, accessibility, and use of advanced technology. Our healthcare coverage is achieved through the National Health Insurance Service (NHIS) and ensures that over 97% of our population has access to quality medical care. We have also made substantial strides in digital health, telemedicine, AI diagnostics, and smart hospitals. Thank you.
Thank you, distinguished delegate of South Korea. The chair acknowledges your delegation's thoughtful remarks and recognizes your emphasis on universal access to free healthcare. Your emphasis on global cooperation, pandemic preparedness, and equitable access aligns closely with the objectives of this committee. The chair encourages further dialogue with other member states on how successful models, such as South Korea's, can be adopted and implemented across diverse countries worldwide. Thank you. The floor is now open to the next speaker. The chair now recognizes the delegate of Bhutan to speak.
Honorable Chair, esteemed delegates, the delegation of Bhutan is honored to address the critical issue of healthcare infrastructure. Bhutan firmly believes that healthcare is a fundamental right for every citizen. Guided by the philosophy of gross national happiness, Bhutan provides free basic healthcare to all its people. Despite facing challenges of being a small and mountainous nation, Our healthcare system prioritizes primary care, maternal and child health, and the prevention of communicable diseases. Nevertheless, Bhutan faces hurdles such as limited specialist services, shortage of medical personnel, and the need to strengthen health facilities in remote areas. We recognize modern technology, international partnership, and investment in medical education are crucial to building a resilient healthcare system. Bhutan supports innovators for greater global cooperation in healthcare with an emphasis on accessibility, sustainability, and equity. We encourage knowledge sharing, financial support for least developed countries, and a renewed commitment to strengthening health systems worldwide. Thank you.
Thank you, distinguished delegate of Bhutan, for your thoughtful and heartfelt contribution. Your emphasis on gross national happiness and equitable access, especially in remote areas, adds a valuable perspective to our discussion. The floor is now open to any points or motions. Are there any delegates wishing to respond to Bhutan's statement? The floor is now open to the next speaker. The floor now recognizes the delegate of Nepal.
Honorable Chair, esteemed delegates, the Federal Democratic Republic of Nepal is honored to address the committee on the crucial issue of healthcare infrastructure, a subject that lies at the heart of the human development and global solidarity. Nepal, as a landlocked and mountainous developing country, faces unique challenges in delivering accessible and quality healthcare, especially to remote and rural communities. However, despite these challenges, we have made meaningful strides through a free basic healthcare system, growing network of community health workers, and strong focus on maternal and child health, but a right realized for every human being. Thank you. Dhanyabad.
Thank you, distinguished delegate of Nepal. The Chair values your contribution to this important discussion, particularly your focus on delivering healthcare to remote and mountainous regions, expanding community-based health services. The Chair encourages all delegates to consider how localized, inclusive strategies, like those demonstrated by Nepal, can be adapted and supported through global partnerships. The floor is now open to the next speaker. The Chair now recognizes the delegate of Italy to speak.
Honorable Chair, esteemed delegates, the Italian Republic is honored to speak on the pressing issue of healthcare infrastructure, a pillar of human dignity, social justice, and global resilience. Italy, with its synthetic national, our universal public healthcare system firmly believes that health is not a luxury but a right granted to all. Our experience during the COVID-19 pandemic tested our hospitals and health workers and also reaffirmed the necessity of prepared, flexible, inclusive infrastructure that can respond to both everyday needs and global emergencies. Italy is committed to strengthening healthcare infrastructure both within and beyond its borders. We advocate for universal access to quality healthcare, especially in underserved regions and fragile states. Investment in sustainable, climate-resilient health systems, particularly in vulnerable areas facing rising environmental health threats. Support for healthcare workforce, including the international cooperation on medical education, mobility, and crisis deployment. Digital health transformation such as telemedicine and AI-based diagnostics while safeguarding privacy and patients' rights. Through the European Union and Italy's development cooperation programs, we continue to support health infrastructure projects, particularly in Africa and Mediterranean region. Let us not forget a hospital is not just a building, it is a symbol of hope, of care, of life. Together let us build a world where every person, regardless of where they are born, has access to the care they deserve. Gracias, thank you.
Thank you, distinguished delegate of the Italian Republic. The floor is now open to the next speaker.
The Chair now recognizes the delegate of Egypt to speak.
Honorable Chair, distinguished delegates, the Arab Republic of Egypt is honored to address this committee to the curricular topic of healthcare infrastructure, a foundation upon which the healthcare security and prosperity nations are built. Egypt has taken important strides recent years for strengthening its healthcare system through the launch of Universal Healthcare System and National Public Health Initiatives. Thank you.
Thank you, distinguished delegate of the Peoples of Republic of Egypt. The floor is now open to the next speaker.
Yes. Point of personal privilege. Personal privilege granted.
The floor now recognizes the delegate of the United States of America to speak.
Honorable Chair, esteemed delegates, the United States of America is honored to address this body on a crucial topic of healthcare infrastructure, an issue that directly impacts global stability, economic resilience, and human rights. As a nation with one of the most advanced medical research sector and robust healthcare delivery system, our United States recognize both the incredible power and the persistent gap within healthcare infrastructure, domestically and globally. The COVID-19 pandemic underscored a critical truth that our healthcare systems are as strong as their weakest links. Whether it's hospital overrun, supply chains broken, or communities left behind, affects ripples across the borders. The United States proposes the following priorities. Global investment in healthcare infrastructure, especially in underserved post-conflict regions through partnerships with WHO, USAID, and the World Bank. Expanding access to medical innovation, including equitable distributions of medicines and digital health tools while protecting intellectual property and ensuring safety. Support for health workforce development, including international training exchanges and funding for frontline health workers. We also underscored the importance of addressing mental care, maternal health, and non-communicable diseases as a key pillars of any modern healthcare systems. Thank you.
Thank you, distinguished delegate of the United States of America. The chair acknowledges your delegation's comprehensive remarks, particularly your focus on medical innovation, public-private partnerships, and the importance of global collaboration in pandemic preparedness and health system resilience. The United States' contributions to international health initiatives and technological advancements provide a significant perspective to our discussion. The chair encourages all delegates to consider how innovation, investments, and strategic leadership can be leveraged to improve healthcare infrastructure on both national and international scales. The floor is now open to the next.
Honorable Chair and esteemed delegates, the Kingdom of Saudi Arabia is honored to address this esteemed committee on the crucial matter of healthcare infrastructure, a cornerstone of national development and global stability. Under Vision 2030, Saudi Arabia is undergoing a historic transformation in its healthcare sector. We are investing in modern hospitals, expanding primary care access, integrating digital health solutions, and increasing the role of private sector, all with the goal of building a world-class, patient-centered healthcare system. Our experience has taught us that strong infrastructure must be adaptive, inclusive, and sustainable. We believe that all nations, regardless of income level, deserve access to healthcare systems that serve the needs of the people. To that end, Saudi Arabia proposes increased collaboration with international partners to develop healthcare infrastructure in low and middle income countries through funding, training, and technology transfer. Investment in digital health platforms, including telemedicine and AI-based diagnostics, to improve efficiency and improve access, especially in remote areas. Support for pandemic preparedness by strengthening surveillance systems and emergency medical response infrastructure. Promotion of medical research and education through regional cooperation and global partnerships. Furthermore, we emphasize the importance of cultural sensitivity and the inclusiveness in sustainable development. We believe that all nations, regardless of income level, deserve access to healthcare systems that serves the needs of the people. Thank you.
Thank you, distinguished delegate of the People's Republic of Saudi Arabia. The floor is now open to the next speaker.
The chair now recognizes the delegate of Germany to speak. Honorable Chair, esteemed delegates, the Federal Republic of Germany is strongly believe that access to high quality healthcare is the cornerstone of a just and resilient society. As one of the world's leaders in universal health coverage, Germany is committed to strengthening the global healthcare systems through innovation, solidarity, and multilateral cooperations. Domestically, Germany operates dual public-private healthcare system underpinned by statutory health insurance that covers more than 90% of our population. We have invested heavily in modernizing our hospitals, expanding digital health infrastructure, and supporting healthcare workers, especially in the wake of COVID-19 pandemic. Germany's e-health strategy promotes telemedicine, electronic health records, and AI-supported diagnostics with the aim of increasing efficiency and reducing disparities in care. We are also advancing mental health services. In conclusion, Germany calls all nations to invest in resilience, inclusive and adaptive healthcare system and to work together in building a world where health is a right, not a luxury. Thank you.
Thank you, distinguished delegates of Republic of Germany. The chair appreciates your delegation's thoughtful contribution, particularly your emphasis on universal healthcare, digital innovation, and international cooperation in strengthening global health systems. The floor is now open for the next speaker.
The chair now recognizes the delegate of Canada to speak.
Honorable Chair, distinguished delegates, the delegation of Canada is proud to address this committee on the vital issue of healthcare infrastructure, an issue that transcends our borders to speak to our shared responsibility to protect human life and dignity. Thank you.
Thank you, distinguished delegate of the People's Republic of Canada. The floor is now open to the next speaker.
The floor now recognizes the delegate of United Kingdom to speak.
Honorable Chair, distinguished delegates, the United Kingdom is honored to address this assembly on the critical matter of healthcare infrastructure, a foundation not only for individual well-being but also for resilient thriving societies. As the home of the National Health Service, a global model for universal publicly funded care, the UK firmly believes that the healthcare is a public good, not a private privilege. Our experience demonstrates the impact of the strong primary care, robust public health planning. The UK proposes the following: increase international investment in health infrastructure, particularly low-income countries, through the WHO Global Fund and the UK Aid Partnership. Support of workforce development, including training and retention of doctors, nurses, and community health workers. Strengthening digital health systems with a focus on transparency and privacy. The UK emphasizes the mental health parity, reproductive to health access, health equity, comprehensive to any other healthcare systems. Let's build a future where all people, regardless of geography, income, or circumstance, can count on their right for being respected and realized. Thank you.
Thank you, distinguished delegate of the United Kingdom of Great Britain and Northern Ireland. The chair appreciates your delegation's valuable insights, especially your emphasis on national health service, equitable access to care, and the importance of strengthening primary health care.
The floor is now adjourned.